It's one of the newest implants on the market, the Inspira Soft Touch. What is it? How is it different?
Over the years, we've had different generations of implants, as they're referred to, and they really translate into how thick or how firm the gel feels. Patients know and understand this because when we give them different types of implants, they can actually hold it and notice an appreciable difference. So we have a spectrum of some that are very soft to some that are very firm. And so we now have a soft touch line that's sort of in between, and is the Goldilocks approach, if you will, to some of those patients that want something that's not quite as firm as the firmest available, and perhaps a little bit more form stable than the older, softer gels that are available.
Are there too many options?
We have choices of size, we have choices of shape, we have sources of profile, and now we have a difference of feel. What is happening is the implant manufacturers, in an attempt at market differentiation, have created more and more options, where now there's hundreds of options for a patient, and the patients are overwhelmed and they're confused. And I would challenge any plastic surgeon to hold a soft touch in one hand and hold a non-soft touch in the other hand and distinguish the two. And you're not going to put them in your hand, you're going to put them under the breast tissue and under the muscle. A difference that does not make a difference is no difference at all. I think it's marketing, and I think it's nothing more.
You know, there is some hype just because something enters the market as new or defined as a specific kind of aesthetic goal that we're trying to transmit for patients. It's not all about marketing. Just because an implant has a certain firmness to it or a shape to it doesn't necessarily translate into a different result. So I think that there's a limited role for some of these new expanding devices. They do exist, but it's certainly not the majority. The vast majority of patients are going to be well served by traditional gel implants that we've gotten really good results with over the years. I really applaud the energy that people are putting forward into this to try and create innovative, better results. But I do think that Richard's point about just because something is new or different and introduced, that is just marketing, and I think that that's something that we have to watch out for.
I've been doing this for 25 years, and every time a new implant comes along, oh, we want to try the newest and the best. And then you look at your practice experience and your revision rate goes up because how you used to manage the positioning of the implants is altered by the new type of implant. So every new product, you have to relearn how to use it. I think that we'd be better served sticking with what we know works, has worked for a long time, and we don't need any more options.
For more information, go to theplasticsurgerychannel.com.